Okay, before tayo mag-proceed sa ating cardiac emergencies and rescue breathing or airway and breathing emergencies, let us tackle first the guidelines in giving emergency care. Okay, so you will be having knowledge on emergency action principle, kung ano ang kailangan gawin kapag ikaw ay susuong sa isang matindihang pagbibigay ng first aid specifically sa ating cardiac emergencies and airway and breathing emergencies. Yan. The number one is scene size up. Okay? Sina-size up ang scene. Okay? Bakit? Para alam mo kung ano ang kailangan mong dalhin ng mga gamit, kung ilang rescuers ang kakailanganin, at makikita mo kung ang scene ba is safe para sa inyong lahat. Okay? Number one is scene safety. Of course, you will need to first aid in a safe area only. Okay? Paano mo nalaman kung scene is safe? Para malaman mo na the scene is safe, kailangan mo umikot, turn around over your victim, okay? Look up and down, left and right, 360 degrees, and then you will declare it. Okay? Sabihin mo, the scene is safe. Okay? The next one is knowing what happened. Of course, kung hindi mo alam kung anong nangyari at wala siyang kasamang ibang tao, mas mag-isa lang siya, hindi mo malalaman kung anong first aid ang ilalapat mo sa kanya. Okay? So kung magbibigay ka ng care, you will always need to know what happened. Kung may mapagtatanungan ka, gawin mo yun. Kung meron siyang kapamilya, tanong mo sa kanila kung ano nangyari. At least ang ibibigay mong care or emergency care is nararapat dun sa kakailanganin ng victim mo. Okay. In knowing what happened, there are subcategories. Meron tayong cause of injury. Okay, kung ano yung cause. The next one is nature of illness. Ano ba siya? Vehicular accident. Okay. Kung nalunod ba, drowning, na kuryente, or whatsoever, at least malalaman mo kung anong nature of illness. Number 3 is role of bystanders. Ang bystander is magiging katulong mo siya in the latter part na mag-first aid ka. Bakit? Kasi sila ang hihingi ng tulong para sa iyo. Example, kailangan mo ng ambulance. Okay? Sila ang hihingi or tatawag ng ambulance para habang nag-first aid ka is alam mo na merong parating na help or medical help sa location mo. Yun ang role ng bystanders. Okay? Hindi lang yun. Pagka nangyari na mag-isa ka lang, tapos napakarami ng i-rescue mo, ang role ng bystanders mo is pwede mo silang turuan. Okay? Tuturuan mo sila dun sa standard of care na nalaman mo para pag na-spread mo yung knowledge mo is magiging katuwang mo sila sa pag-first aid. Okay? You need to educate them ng mabilisan para at least yung mga simple techniques lang is matulungan ka nila. Medyo mababawasan ang tatrabahuhin mo. Yun ang pinaka-role ng bystanders. Okay? Number 4, number of casualties. Kailangan size up mo siya kung ilan ang casualties na injure. Bakit? Para alam mo kung ilang tao din ang rescuers or first aiders na kailanganin mo. Okay? Isa pa, titignan mo kung ang supply or medical supplies na dala mo is sasapat dun sa number of casualties na injure. Okay? Next one, asking permission or consent. A while ago, I was talking to this na kailangan mong mag-ask ng consent. Okay? Sabihin mo lang, Ma'am, Sir, I am Sergeant Navarias, Philippine Air Force, a trained first aider. Can I help? Okay? That's clear. Okay? Tapos sasabihin niya, okay, sige, patulong naman ako. Kailangan namin ng tulong. That's the time na mag-i-start kayong mag-first aid. Never ever papasok sa isang scenario na hindi ka nag-ask ng consent. Okay? That's the number 1 rule. Primary assessment. Pag sinabi primary assessment, meron tayong sinamarize na AVPU. Okay? Titignan mo dito ang patient's response level. Ano yung AVPU na yon? A is for alert. Okay? Alert ba siya? Responsive to voice, responsive to pain, or unresponsive. Pag sinabing alert, ang category mo, dapat alam niya kung anong oras na ba, alam niya kung anong pangalan niya, okay? Tapos, meron ba siyang natatandang kamag-anak niya? Ibig sabihin, kung alam niya ang time of the day, alert siya. Okay? Para ma-confirm mo, itanong mo na rin kung anong pangalan niya, kung nasang lugar siya, at kung anong nangyari. Okay? Pero pagka hindi talaga siya makausap ng maayos, at saka ka magpuproceed sa letter V, which is the responsive to voice. Pag sinabing responsive to voice, sabihin mo lang, ma'am, sir, kaya niyo po bang itaas ang kamay ninyo? Pag tinaas niya, okay, that's what you call the responsive to voice. Okay? Yun ang responsiveness level ni victim. Pero pag ang responsiveness ni victim is responsive to pain, kung kailan ka nag-inflict ng pain, example, nag-inflict ka ng pain dito, okay, tinanggal niya. That's the time na ang victim mo is responsive sa pain. Yun yung level of responsiveness ni victim. Okay? Responsive to pain. Paano naman kapag unresponsive or unconscious? Sinubukan mo yung tatlo, hindi siya alert, tinatawag mo siya, hindi siya sumasagot, tapos nag-inflict ka na ng pain sa victim. Okay? So, ang responsiveness level ng victim is unresponsive or unconscious. That's the primary assessment. Okay? Next is activate medical help. Ask someone to call for local emergency number. By the way, ano ang local emergency number na pinakamalapit sa'yo? Alam mo ba kung ano yon? Dito sa Clark, ang number ng hospital natin is 6091. Okay? Sinong mag-a-ask ng call or sinong mag-a-ask ng help for the local emergency number? That is your bystander. Sila ang uutusan mo. Pag nag-utos ka, make sure na yung inutos mo sa kanya is matatanggap niya yung responsibility na inatang mo sa kanya. Okay? If possible, pag meron ang hospital na tinawagan ninyo or ang ambulance, please bring an automated external defibrillator if possible, kung meron. Okay? What are the information to be remembered in activating your medical help? Number 1 is what happened. Tatanungin kasi yan ng tinawagan mo kung anong nangyari. Dapat mo masabi yun. Okay? The next one is location of emergency. Be specific kung saan ang location ng pinangyarihan ng sakuna. Okay? Bakit? Para hindi maligaw ang ambulansya at hindi mag-consume ng time ito pag pupunta sa location. Okay? Next, the number of person injured or ill. Kagaya ng sabi ko kanina, kailangan nilang malaman kung ilan para sapat ang supply or medical supplies na dadalhin nila papunta sa pinangyarihan ng insidente. The next one is cause and extent of injury and nature of illness and first aid given. Okay? Dapat mong sabihin kung saan ang extent ng injury nila or ano ang nature of illness para makapag-decide sila kung tama ang mga equipment or medical equipments na dadalhin nila papunta sa inyo. Okay? The next one, telephone number from where call is made. Kailangan mong sabihin na, ma'am, sir, ang gamit ko pong ito is cellphone na number ko. Or ang phone po na ito is dito sa may telephone stand dito sa location namin. Bakit mo kailangan sabihin ng number? Kasi malay mo, meron nakalimutan ang telephone operator ng hospital na kailangan niya ulit malaman. Of course, tatawagan ka niya kung anong number ang ginamit mo. Okay? Next one, name of person who called medical help. Always assure na dapat sabihin mo ang pangalan mo sa kanya. Nakuha. Airway. An open airway allows air to enter the lungs for the person to breathe. Okay? If the airway is blocked, the person cannot breathe. Meron tayong 3 ways, okay, na pag-open ng airway. Sa adult, ginagawa natin is maximum head tilt chin lift. This one, nasa gitna. Okay? Maximum head tilt chin lift. Your left hand is dito sa may noo. Okay? Sa noo ni victim. Your other hand, yung index finger and middle finger is siya ang magsusupport dito sa baba. Your thumb is the one who will open the mouth by simply retracting the chin of the victim. Pero before mo i-retract yun is dapat i-maximum head tilt siya. Then, open. Okay? Let's take a look at the picture. The next one is the jaw thrust maneuver. Bakit kailangan ang jaw thrust maneuver? Kasi meron kang suspected spinal injury sa victim kaya kailangan mo ang jaw thrust maneuver. Okay, paano ginagawa yon? Ganito siya. Ito, tatlong kamay mo, tatlong daliri mo ay dito sa panga ni victim. Okay? Ang index finger mo is dito sa cheek, tapos ang isa is dito sa may temporal. Or kung kaya mo abutin ng noo, much better. Okay? So, nakaganon siya. Then, retract. Bakit? Ba't kailangan ng jaw thrust maneuver? Para kapag i-move mo si victim is hindi magagalaw ang alignment ng kanyang cervical spine kasi meron siyang suspected spinal injury. What about the infant? Sa infant naman, tinatawag doon is neutral position ng airway nila. Ayan, nakasupport lang ang isang kamay mo sa ulo niya. Hindi mo siya i-extend, okay? Hindi mo siya i-flex. Neutral lang talaga. Yung iba, bis na ganyan, naglalagay sila ng dalawang finger dito sa may groove ng neck nila. Okay? Ipapatong lang nilang ganyan dun sa ilalim ng batok pang support. Okay? Breathing. While maintaining an open airway, quickly check an unconscious person for breathing by doing the LLF technique. What is LLF technique? That is letter L, look for the rise and fall of the chest. The other L, listen to the oozing sound coming from the nose and mouth. Okay? Letter F, feel the air coming from the mouth or nose. Okay? That is for no more than 10 seconds. How's the counting? The counting is 1, 1,002, 1,003, 1,004, 1,005, 1,006, 1,007, 1,008, 1,009, 1,010. Okay? The next one is circulation. We do have our pulse. Sinabing pulse, check for the definitive pulse at the carotid area of the adult or child. Okay? This is the carotid area. While for infant, brachial ang pag-a-assess natin ng pulse. Where's brachial? Ito po. Kung ito ang kamay niya, nandito po sa may decubital space. Kung nandito ang siko mo, nasa kapila siya. That is what you call decubital space. Okay? Applicable for professional rescuers and healthcare providers. Next one is bleeding. Always check for bleeding. Bakit? Blood loss can cause shock, and shock can cause death. Okay? Quickly look for severe bleeding by looking over the person's body from head to toe for signals such as blood, soaked clothing, or blood spurting out of the wound. Okay, bakit kailangan mong tingnan ang bleeding? Kasi pwede siyang mag-result sa shock. What is shock? If left untreated, shock can lead to death. Always look for the signals of shock whenever you are giving care. As we go on to our lecture, you will be educated regarding the shock, kung ano yung uh, signs and symptoms niya, kung paano siya i-treat, okay? Paano siya tapatan ng first aid. For now, let's leave the meaning as is. Okay, just read it muna. The next one is skin color, temperature, and moisture. Assessment of skin temperature, kung ano bang kulay niya. Namumutla na ba siya? Kulay blue na ba? Okay? Or sobrang red na ng balat ng victim. Okay? Sa color yun ha. Sa temperature naman, titignan mo kung ano siya, cold clammy skin ba siya? Kung mainit-init ba? Meron ba siyang fever? So you will assess for that. The next one is the condition or yung sinasabing moisture ng victim. Basa ba siya ng pawis or super dry ba ng balat niya? Okay? Kasi sa condition na yon is it can tell you more about the patient's circulatory system. Okay? Secondary assessment. Those were primary assessment yung tinakal natin. Ayan. Number 1 is yung primary assessment is activate medical health. Number 2 is airway. Number 3 is breathing. And number 4 is circulation. Okay, let's move on to our secondary assessment. If you determine that an injured or ill person is not in an immediately life-threatening condition, you begin to check for other conditions that may need care. Okay? Kung ang victim mo is na-determine mo na hindi naman immediate life-threatening ang kanyang condition, that's the time you will go on to the secondary assessment. Okay? Unang-una, nakakausap mo siya. Conscious siya. Okay? That's a good sign na hindi life-threatening ang condition ni victim. Ano yung mga secondary assessment? By merely interviewing the person and bystanders. 2, checking the person from head to toe. Pag sinabing head to toe, you will do it religiously. Simula sa ulo hanggang sa paa. One by one ang kamay, one by one ang paa. Okay, sa dibdib, sa likuran, sa tiyan, lahat yun i-assess mo. Kaya nga, you will check the person from head to toe. The next one, checking for vital signs. What are the vital signs of ordinary victim? Okay? Pag sinabing vital signs, it shows the data of your vital organs. What are those? Number 1 is your heart rate or the pulse rate or the cardiac rate. Number 2 is the body temperature. Okay? Number 3, your respiratory rate. And lastly is the blood pressure. Ayan. This is your secondary assessment. Look for the mnemonic sample. What is sample? S is signs and symptoms. A is allergies. M is medication. P, pertinent past medical history. L is last intaken output. E is events leading up to the injury or illness. And look for DOTS or DOTS. What is DOTS? That is deformity, open injuries, tenderness, and swelling. Another one is you need to do the VITE. What is VITE? That is V is vital signs, I is interview, D is document or documentation, and letter E is endorse. Okay. That's all what you have for our guidelines in giving emergency care.